About a year ago, or a little more than a year ago, the DTC endorsed the plan for healthcare reform in Connecticut, and as you know, it was passed. But a lot of that has not been implemented yet, and it will fall on next year's legislative session to make sure that the provisions that we were looking for will go into place. And Barbara Edinberg with the Bridgeport Child Advocacy is continuing to work for healthcare for everyone. And she's going to give us an update and tell us where we stand and what needs to be done. So without further ado, Barbara Edinberg.
Thank you. I have some materials. Thank you so much for having me back. It's been a long day, so I'm going to use my notes, so I hope that that's okay. Forgive me. Let me tell you who BCAC is, Bridgeport Child Advocacy Coalition. We are a nonprofit, nonpartisan coalition of 80 member organizations organized really to improve the well-being of children, not just in Bridgeport, but statewide, and we do that through research, through education, mobilization, and advocacy. And over our 25-year history, we've had a lot of accomplishments, and I know many of you have been involved with us, and we really appreciate all of your help. As Devin said, we've really been working hard to build support for affordable health care for Connecticut residents. And a lot has happened since I've spoken to you. I think I looked back in my notes, it was about a year and a half ago. And as you know, state reform through Sustinet was passed in July of 2009, and national health reform was passed in March 2010. And so what I want to do today is talk a little bit about national health reform, a little bit about Sustinet, how the two are going to work together, and that what we need to do here to make sure that things move forward. Because I'm sure unless you've been living in a cave, you've probably been hearing there's a lot of rumors, a lot of myths, a lot of bad information that's circulating. It's getting people scared and worried and nervous. And so the more informed we are, the better off we are in telling our neighbors about the benefits of having health reform. So let me first talk a little bit about national health reform. And it has three basic features. It protects consumers like you and me. It promotes better care and better health control costs. And it offers new insurance choices to make sure that people are covered and have the health insurances they need. So some of the protections, and there are a lot of, and I've been to a focus group that was held in Stanford, and people didn't know that it was all really about national health reform. And they started saying how much they were against national health reform and everything that's happening. It's socialism, it's government's taking over. And then as the facilitator went into the various pieces of the bill, they said, oh yeah, I like that. Oh yeah, that makes sense to me. Yeah, that's good. And so what we're finding is people are scared and they're nervous, but when they hear about the positive benefits of health reform, they say, oh yeah, I like that, that's good. And so that's what we're trying to do, is make sure people have the information. If you have a pre-existing condition, you have to be covered. Children have to be covered with a pre-existing condition starting now. They're already on. Most of the other changes are going to take place in 2014 at the national level. No longer, and I like this one in particular, no longer will we have gender discrimination. My rates where I work are much higher than for a man of the same age. Women cannot be charged higher premiums, and things like maternity coverage must be covered. There will be no lifetime caps on coverage. That is something, frankly, that I worry about. What if I got really sick? And I went through, we have $1 million lifetime coverage at the plan where I work. If I go through that, if I have a major catastrophic illness, I could go through that in next to no time. Starting September 23rd, when you re-enroll in a new plan, in your own plan, or you get a new plan, there will be no lifetime caps. Insurance companies cannot cancel you if you get sick, and it requires insurance to cover things like physicals, so it incentivizes prevention. It also helps seniors with the high cost of prescription drugs and filling that donut hole. So how is national health reform going to promote better care and control costs? Well, first of all, as I already said, it's going to incentivize prevention. If you don't have to pay out of pocket to get a physical or get a screening test, like a colonoscopy, you're more likely to do it, right? So it's going to encourage people to take preventive measures. It's going to transition to the use of electronic medical records to help avoid duplication. There's going to be care coordination by a healthcare professional to make sure that you get the care you need and also don't get duplicated tests. It's going to invest in workforce development to make sure we have enough doctors and nurses to cover everybody to provide the health care that we're going to need as health insurance becomes mandated. And we're hoping 95% of Americans will have coverage. And it also invests and improves home-based and community-based health services to help keep people in their homes. And public health programs to fight obesity and tobacco use. There will be new insurance choices available through national health insurance or health reform. Each state must establish a high-risk pool for adults with pre-existing conditions starting now. Some states have opted for the federal plan, but they're starting that now, and we have that here in Connecticut. Each state is going to develop a website to help people shop for their insurance. There's going to be insurance exchanges. I liken it to a supermarket. You're going into the supermarket and having a choice, or for people who use the net a lot, if you use Travelocity or one of those websites to help you choose the cheapest way to travel, it will be, the exchanges will be like that. You will be able to go online and see the choices that are available to you for insurance, and you can shop for the plan that is best for you and your family. So let's talk about Sustinet. That is the state health reform law that was passed in July of 2009. That's going to mean better choices for Connecticut residents, and it will, in effect, be Connecticut's public health option. Sustinet is scheduled to roll out in 2012. That's a year from now. And we need some legislation put in place to make sure that that happens. Because for some of us who are concerned about waiting to 2014 when we'll have affordable health insurance, I don't know if I can wait that long. The advantage of Sustinet is we'll be able to have that available to us 2 years earlier. It was developed with 3 years of solid research with input from business, hospitals, doctors, clergy, labor, you name it. There was a lot of input into what the plan would look like that would be best for Connecticut. When fully implemented, Sustinet is going to deliver quality care, promote good health, control health costs, and streamline the state's health care plan. Sounds very similar to the national health reform, and it is. In fact, the two are going to work hand in glove. And because Connecticut has done so much work already, we believe that we are well positioned for a lot of federal dollars coming down the pipe for pilot programs, and we'll be able to get a jump start. Beginning in 2012, Sustinet is going to be available to small business owners, the uninsured, self-employed, nonprofits, municipals, cities, and towns. Participation is voluntary in Sustinet. If you have health insurance and you like it, you keep it. No change, no difference. But if you don't have health insurance, or you have a plan that's very expensive, or it doesn't cover what you need, you would be able to buy into the Sustinet plan. So how does Sustinet work with federal health reform? As I mentioned, it helps Connecticut leverage new dollars. And in fact, this is already happening because of national health reform. Beginning in July, just this past July, low-income adults who had been on the state assistance health program, it's called SAGA, if you're familiar with that term, And beginning in July, because of national health reform, the state of Connecticut was the first state to ask the federal government if it could transition those adults to the Medicaid program. And what that meant was two things. One, it gave those individuals better benefits, because Medicaid is a very good program that provides the kind of health care coverage that people need in health services. But more importantly, for the state of Connecticut, the federal government reimbursed 100% of those costs for every new adult that got onto Medicaid. And that was huge. And in fact, Connecticut built that into its budget. There is a board, a public-private board, that has been meeting regularly since Sustinet was passed. And it has a number of committees that have been working out the details and the specifics of the plan, like the cost. And what is this going to look like? And exactly what are the benefits? And all of the infrastructure things that take time to develop. The recommendations of the Sustinet board are going to be coming out in December of this year. And that's when the fun begins. Because even though it passed, Sustinet passed, and the legislature said, yes, you can go ahead, you can work and put all the plans in place and the specifics. We need now to get legislation passed to make sure it can actually be implemented. That we have the dollars we need and we have the legislation we need to make sure it rolls out. We cannot pull back.